Someone dies from cardiovascular disease about every 37 seconds. Heart disease and stroke are at the top cause of death for women. Stroke affects African Americans at an extremely higher rate. Yet, African American women are less likely than their Caucasian counterparts to even be aware of these statistics. Every day in my role as a cardiac clinical nurse specialist, I see this impact of heart disease. That's one reason I participate in the Heart Walk. I also walk because I've seen up close and personal how heart disease and stroke can affect a loved one and their family. I'm talking about my Aunt C, a retired registered nurse who not only delivered me, but saved my life, since I was born with the umbilical cord wrapped around my neck and was not breathing, so she resuscitated me. I also work for Aunt C because for a good part of her adult life, she has battled heart disease. She has had multiple heart attacks, has been resuscitated many times, and has had cardiac bypass surgery. By the grace of God, she came through every time. In the summer of 2012, my beloved Aunt C had a life-altering stroke, which paralyzed the right side of her body. Needless to say, this meant she could no longer be fully independent, which for her was like torture. She had always lived her life on her terms, and now she had to rely on others for the basic of needs. My aunt, a woman of color, a professional woman, didn't always stick with specific dietary restrictions or her medication regimen. Living on her terms meant she didn't follow the plan of care put together by her medical providers. Unfortunately, I often see the same when I interact with patients and their care partners, and I meet with many African American women. Yes, some do not understand their risk factors, disease prevalence, nor the signs and symptoms, but some do and still choose to not follow the diet and medication regimen prescribed for them. So I'm also sharing this story to bring awareness to the fact for the countless people and families being impacted by heart disease and stroke. In many situations, they're preventable. As a woman of color and of Asian descent, I also walk because heart disease and stroke don't respect anyone and can affect any one of my family members, friends, colleagues, and patients. I walk because we need more research on how to combat what can be lifelong, debilitating, and costly diseases. I walk to encourage others to pay attention to their bodies and seek medical assistance sooner rather than later. I walk because I know that together we can help millions have a better quality of life.